Hello, welcome to In a Heartbeat, coming to you from WMTV studios in Grosse Pointe Farms at the War Memorial. I'm Dr. David Balle, and I'm your host for In a Heartbeat. Today, I'm very happy and excited to have as my special guest, Dr. Joan Crawford, who's a cardiologist, and I'd like to welcome you to our show today. Welcome to In a Heartbeat, Dr.
Thank you very much.
Crawford. And as a start, Dr. Crawford, we're going to be talking about things related to heart attacks and special symptoms and concerns that occur with women. If you could tell us a little bit about the focus of your specialty and the role that you play in practice and in the hospital.
Perfect. Well, first of all, I am local as well. Our practice is out of St. Clair Shores, East Lake Cardiovascular, and I worked at St. John and Beaumont Grosse Pointe years ago, so I've been local to this area for a long time. I am a non-invasive specialist, so I run the stress and echocardiography lab, which is if you have a cardiac condition and you need to get some testing, you might see a cardiologist, and then when you have to go for testing, I run the quality, I make sure the equipment, the sonographers, everything is good and excellent, and try to help keep track of things like that.
Excellent, excellent. And just to kind of maybe set sort of the stage of what we're going to talk about, what is a heart attack, and what are some of the symptoms? How does somebody know if that may be a possibility?
Well, first of all, I think the heart attack symptoms are a little different depending if you're a man or a woman, so I'll start with a man. Mm-hmm. I think back in my mother's era, Reader's Digest days, we all came to learn that a heart attack for a man, if someone went like this and kind of clutched their chest, got a little pale, nauseated, sweaty, went to the left shoulder or the jaw, they better get their husband to the hospital right away or call 911. So I think that's pretty clear. And by the way, take an aspirin on your way there. For a woman, it's a little different. Women's symptoms are very vague. Sometimes they don't have chest pain. In fact, only about 30 to 40% of women actually have chest pain. So many women wait up to 12 hours, unfortunately, before going to the hospital. And with our whole thing of time is heart muscle, we need to get into the hospital, into the cath lab, get a blocked artery opened up. That really can be very bad for a female because then they have bigger heart attacks and they have more heart failure and problems like this because they thought they were having a gallbladder attack or indigestion or they were just tired. So I think to go over the specific symptoms really.
And we were talking a little bit earlier before we sat down today. It was sort of not even well recognized that women had heart attacks, wasn't it?
So back in the 80s, I'd say, they didn't even know women had heart problems. In fact, everybody thought it was just a man's disease.
That's amazing.
So if any woman went to a physician, even the physicians would think she was just anxious or hysterical. And they really had to go forward and legislate that if we did studies on heart patients, that they actually had to include women in the studies. And what we have really since found out is that 1 in 3 women die a cardiovascular death. So women tend to think, although this is improving, that they're going to die of breast cancer or some sort of female-related problem, but the truth of the matter is, if you take all cancers and combine them, heart disease far surpasses still what women die of. So I think your question, going back to what are the symptoms, it's really important to know that only maybe 30 or 40% of the women will have chest pain. If they have arm or shoulder discomfort, it's not necessarily the left arm and shoulder, it could be the right or the left. A lot of women have, the word is epigastric, but it's right here. It's sort of the top of the stomach, the bottom of the chest. And it's just a pressure sensation. So a lot of women that have a hiatal hernia or that have prior ulcers or something, they just think maybe they ate something funny and it's an indigestion, a severe indigestion thing.
I think that would be easy to kind of...
It is easy to miss, yeah.
Kind of just sort of discount it as something like that.
And then another thing that's, I think, real important, a lot of women that wear a bra or a brassiere just think their bra's too tight because they get a band-like tightness around the chest. And so they may say, like, yeah, I thought maybe I had to get a new bra size or, something as simple as that. I think the other thing really is fatigue, which is another very vague symptom. But I like to use the example, if you're 70, and you've been 70 the whole year. And the beginning of this season, you go out and get your ground ready to make a garden, and you did all that this year, and then next year you're tired, you're exhausted, you get up, you eat breakfast, and you want to go back to bed, or you just don't have the vim and vigor that you used to. Sometimes that alone, just being tired all the time and you can't do what you did the year before, that alone should prompt you to go in and get see your doctor and get appropriate testing.
That's excellent advice. What are when somebody has chest pain, let's say typical chest pain, at what point do they have a level of concern where they think maybe something's going on related to my heart?
Well, if you've ever had a cardiac condition, a lot of times your doctor gives you a little bottle of nitroglycerin pills. If you haven't had one, then you don't really know what you're looking for. So I think the people who've never had a heart problem, it's still a little confusing. You don't know what to do. So I think, for example, if you've had a heart problem, you carry this bottle of nitro around, but everybody's a little afraid to use it because they don't know what's going to happen. So I think if you are doing something and you're having chest discomfort, the first thing you should do is kind of stop and just take note of what's going on. I don't feel right. I would really suggest to people to reach out and call a daughter, a son, their husband, their wife, a neighbor, somebody to kind of let them know what's going on. And then if it is somebody who's been through this before and they think they might use nitro, I kind of tell them, why don't you just meander into your front room by the front door, unlock it, have your cell phone with you, and just kind of sit on the couch and wait a couple of minutes. If it doesn't go away just from stopping what you're doing and things have to progress, then really that's, within 5 or 10 minutes, that's the decision point where you say, do I actually need to go to a hospital, or can I just take a nitro pill and an aspirin and wait, and this will pass? So we usually tell people they can take a nitroglycerin up to 3 times, 5 minutes apart. So if you have no nitro, what do you do then? Well, you sit down, you wait, and I think you try to make the decision within 5 to 10 minutes of whether you need to reach out and go to the hospital. I've heard from so many men and women that if it weren't for their partner saying, this is not normal, you don't look good, you look gray, you look pale, and you just don't look right. So a lot of times it's the person with them that really says, we need to take action here and not just sit home because you don't look right. And I think, the message, if somebody says that to you, pay attention and just better to be a little bit embarrassed and go get the EKG, if in fact it's a false alarm. I will say out of all the people that come to ERs with chest pain, probably 70% of people end up finding out they were stressed. They had a stomach problem. Something else was going on. But again, if it's the real deal and you really belong in the cath lab, time is muscle, and we really try to get everybody in the cath lab within that first hour of when you have chest discomfort. So that's why, if you think about the triage, getting in, being taken in, the nurse checking you into the hospital, getting an EKG, we try to do all that within the first 10 minutes that you step in the door. Also, you asked me a little bit before, what is a heart attack? So there's really 2 different things. One, doctors or cardiologists like to call themselves plumbers or electricians. So, we tend to think of a heart attack as a blocked artery. So when we do a cath and we put a wire down, blow up a balloon, maybe put a stent, we're kind of opening up that blood vessel again, just like if your kitchen sink was plugged, the plumber comes in and opens up the kitchen sink. That's not the only way to have a heart attack, though. Some people can have a heart arrhythmia, which is more of an electrical problem. And electrical problems can be skipped beats, palpitations, simple things like PVCs. People may have heard of atrial fibrillation. Usually those are not deadly. They're inconvenient and we have to do things about those types of problems. But people can have ventricular fibrillation, ventricular tachycardia, sudden cardiac death where they just drop, and it may be because of a blood flow problem, but it may be primarily also because of an electrical problem. In the ER, you can tell the difference really because the EKG looks way different if you've closed a blood vessel, and those are the people that have to go directly to the cath lab.
Dr. Crawford, you'd probably say that, and just so people know, there's probably a tendency when people start to perhaps feel these symptoms or perceive something is going on, there's a tendency to discount it a little bit, don't you think, or rationalize it's this or that. And, you know, it's, so you'd really encourage people to you know, try not to do that.
Well, there's two statistics that I think are like, oh my gosh. One is that the first symptom for women, many times, is sudden cardiac death. So that's not the symptom you want to have, for sure. So in retrospect, you know, for the people that survive and do well, in retrospect, they almost always say, I was more tired, I should have recognized it. I was having some discomforts in my upper abdomen or in my chest. It just didn't occur to me, I didn't know. And the other thing, as I said, that most women take up to 12 hours to come to the hospital. Like somebody can be having a heart attack and they're like, you know, I have to pack lunch for Susie or Johnny before they go to school, or I have to get my husband off, or I have to make 3 appointments, or I better shower before I go to the hospital. And I mean, those are all things that the Go Red for Women campaign, so the American Heart Association, you know, 15 years ago started this Go Red for Women. There's a red dress, just like breast cancer has the pink ribbon. Yes. We have a red dress, and the month of February is Heart Month for men and women, but that's where the Go Red for Women campaign tries to get, you know, the news people to wear red, or, you know, buildings to go red. So we talk about going red for women just to get the symptoms out. And I have to say it's a grassroots effort, and people like myself and other volunteers, you know, go into churches, synagogues, schools, businesses, and try to do lunch and learns or breakfast and learns, or just try to get into where we talk to women directly and make sure that they know these symptoms, because sometimes even, it's getting better, but sometimes even the physicians don't really realize 1 in 3 women die of heart problems. And so sometimes we have a problem where the woman is recognizing something's the matter, but it's actually kind of scary, because even when women go to a physician, a man with the same symptoms is going to get a stress test right away. The women, they might get a blood test, they might or might not get an EKG, they might just get their thyroid tested. So, you know, this is where if we go out and talk to women directly and say, you really need to recognize your symptoms are different, and if your doctor's not listening, you know, try one more time, have another conversation. Maybe you need to switch doctors or go to a specialist to say, I don't feel like, you know, my physician is hearing what I'm saying, and that, you know, I really feel like I need testing. I think something's wrong, and, you know, especially if they have a strong family history and other correctable risk factors like diabetes, smoking, obesity, lack of exercise, you know, all those things, you should know you're at higher risk and try to correct those deficiencies.
I'm listening to what you're saying, and I think that's so true, and I'm sure you found many examples of that in your practice. I think patients have to be some of their own best advocates.
Correct.
And I think you have to trust how you feel, and have the confidence and courage that if somebody's not, as you said, seeming to follow up on what you're telling them, to be more persuasive or get a second opinion.
Right. I think it's exciting because I really have been involved with, you know, Go Red for Women since the beginning, 15 years ago. And I really have a lot of patients coming into the office now saying, I've been hearing on TV, or I've been hearing on the radio, or I've been hearing on shows like yours that, you know, women have different symptoms, and I just think I need to get checked out. And I think we're really starting to make a difference. And I think, you know, we're educating other physicians as well, and it is making a big difference. So thank you for letting me get my voice out to more people than just in the office today.
It's our pleasure. Thank you. You're taking time out of your busy schedule to educate people. We certainly appreciate that. So I think people are aware of things like congestive heart failure or angina, but may not exactly know what that is. Maybe you could explain a little bit about that.
Absolutely. So congestive heart failure is a process where the heart pumps blood, but in a less efficient manner. So there's 2 types of heart failure. One where the heart muscle is weak and flabby, often after a heart attack. And then there's another type of heart failure where the heart muscle is actually sort of thick and stiff, and so it becomes less efficient. In hospital terms, the weak heart is systolic heart failure, and in hospital terms, the strong heart is diastolic heart failure. Some people are hearing these terms now, so they do actually know which one they have. The medicines are similar but different, and often you have to be on things like Lasix or a water pill. You have to be on a beta blocker, and names that people might recognize are Coreg or carvedilol or metoprolol or Toprol, ACE inhibitors like lisinopril or enalapril, things like that. Other medicines more specific that you could talk to a patient one-on-one. But I think one of the common sense things that I would love to get out message-wise is if you have congestive heart failure, there's 2 or 3 things you need to do at home and be, again, your own advocate. Number 1, simple thing, own a scale. Own a blood pressure cuff. Because when you start to hold water, your weight will go up. So if you weigh 150 or 250 pounds, whatever it is, if you suddenly gain 5 pounds in a 24-hour period, it doesn't matter how much you ate, you cannot gain 5 pounds in one day. So if you gain 1 pound the next day, 2 pounds the next day, and the next day 3 more pounds, that is when you're retaining water and you're about to have a bout of congestive heart failure. So what we try to tell our patients, and we try to give them direction, is take an extra water pill. You have to do this under your doctor's recommendations, but and also look at your diet, because I hate to say, but most people do it to themselves. You're really supposed to be on a low sodium diet, and many people say, well, I don't use a salt shaker, but they kind of aren't counting. They decided to go through a drive-through, or they decided to get a pizza, or our elder patients, sometimes it's too inconvenient to cook your own stuff every day, because many times they're cooking for 1 or 2 people. And so they tend to get frozen food that's highly salted.
And a lot of processed food or food prepared in a restaurant, they flavor it with salt.
Correct. And believe me, one of the apps I like to use, MyFitnessPal, where you put it on the phone and you can look it up. There isn't a restaurant in the world, unfortunately, that doesn't use a fair amount of butter, cream, salt. That's why we go to restaurants that all taste better. And it's convenient, you just get it to go and bring it home. So the problem is a lot of middle-aged, well-meaning kids will stop by mom and dad's favorite restaurant, get something to go and bring it in just to make it easy. And sometimes that's a mistake as well. So own a blood pressure cuff also, because we kind of always say know your numbers. And if your blood pressure is constantly higher than 130/80, the American Heart Association just this last month came up with, we're kind of letting blood pressures go too high again. So a lot of people at home are seeing 140s, 150s over high 80s, low 90s, and saying they're controlled. And really, we're trying to get the message out again that you're not actually controlled. You really should be more in the 130/80 or better range, unless you have certain symptoms like a prior stroke, or if your blood pressure's too low, you don't feel good. But there's so many side effects like kidney failure and heart failure and thickening of your heart muscle that can happen when you let that blood pressure be 150, 160, 170 over 90 or 100. And I can't tell you how many people I still meet today that when they come to me and their blood pressure is 170 over 100, they're like, oh, my blood pressure's been like that for 20 years. The doctor can't get it down. And I'm like, start checking it at home twice a day, and I'll give you, just like a diabetic, if you're not supposed to eat chocolate cake, but what if you do? And your sugar suddenly goes up to 400. You shouldn't just say, oh, my sugar's 400, that's bad. Your doctor probably gave you some insulin and says take a little bit more insulin if that happens. Well, in the same way, work out a plan with your doctor. If you're going into heart failure, don't just say, oh, I called, I got an appointment, but they can't see me for 2 weeks. A lot of us have nurse practitioners that you can add people in, or you could discuss things over the phone, or you could have a plan of action. You're allowed to take a second water pill on days that you're 3 pounds higher, or you're allowed to take this particular extra blood pressure pill if your blood pressure is more than X, Y, or Z, and kind of have these plans worked out with your doctor so that you're in control of your disease instead of your disease being in control of you.
And I think you're right. I mean, we have to own those things and be a participant in the control of them. Dr. Crawford, you've touched upon some of those things already, but if you have any other sort of heart healthy or preventative measures that you'd like to kind of discuss,
I do.
Love to hear them.
Well, one thing is that heart disease is entirely preventable for the most part. Yes, there's family history, but there's still a lot that we are doing wrong that leads to us having further problems. If I haven't mentioned lately, stop smoking, stop smoking. Unfortunately, diabetics have multiple times more heart attacks and problems than people who are not diabetic. And you can kind of see diabetes coming. You know, we're supposed to know our numbers. We're supposed to know our blood pressure should be 120/80. We're supposed to know our cholesterol should be under 200. We're supposed to know our waist size, you know, we should be more shaped like a pear, less like an apple. If you have a lot of belly fat, that's not a good sign. If your waist is too big, that's not a good sign. If your triglycerides are too high, that's not a good sign. So if you're pre-diabetic, is there such a thing as pre-diabetes? You know, it's kind of like, are you a little pregnant? So if your sugars are starting to run high, that is the time. You know, really your sugar should be under 130. And if you have, you know, borderline diabetes, I would talk to your family care doctor and try to get a finger picker at home so again you can keep track of that, because diabetics have so many more problems. You should try to be normal weight. The American Heart Association says that kids should be exercising 60 minutes a day. They say adults should be exercising 30 minutes a day. We can't, you know, sometimes going to the gym, you know, I think people take more time packing their clothes and schlepping it in than they actually spend doing the exercise. So
or talking to others when they get there and
exactly.
socializing.
And I mean, there's nothing wrong with, you know, you're at work in a building that has a staircase. You know, do not take the elevator. It's not that you can't climb the stairs. It's just you're in the habit of going and pushing the button. But, you know, start walking or park at the back of the parking lot and walk in a little further, or, you know, bring a handy low-calorie lunch that you can eat at your desk and then take the other 25 minutes and go for a walk.
I think a lot of people, and I'd be interested in your opinion, have sort of lost a conception of what normal portions are in food.
Oh, I think everything is supersized now.
Yes.
A lot of our grandparents, you know, may have had meat with many meals, but how is it they lived to be 90 years old, you know? And I think there's a lot less trans fat in their diet. I think that they did a lot more walking and exercising. They you know, we drive everywhere. You know, they kind of say sitting is the new smoking. So, you know, at work, if you could have walking experiences or take the stairs or those kind of things. I also am a big advocate of actually taking the time the night before to prepare some food from home and bring it. And I am a super busy person, so anybody who tells me why they can't do it, I'm like, hold on, you know, I'll...
And Dr. Crawford, I'm just like you. I don't feel like doing it, but I always make my lunch myself the next day after I've eaten and when I'm not hungry.
That's a good idea. And it's always easier if you're making baked chicken or something to make one extra piece.
Sure it is.
Slice it up, you know, make that beautiful salad with multiple colors. And I think it's a good idea to have different, you know, Tupperware style containers that you're putting food in, because it keeps you honest. I kind of say, you know, eat what's in your bin or your bowls, and don't go grazing, you know, like somebody dropped off bagels or donuts at the office and you didn't come prepared and you're too busy to go out to buy something healthy, so you end up taking something.
And people say eating like a Mediterranean diet is helpful. Do you have a thought on that, or
No, I
what
think
is
it
the
is.
Mediterranean
I think there's a lot of good diets. I think, you know, there are healthy fats if you think about it, and avocado is probably a healthier fat than steak is, for example. A vegan diet's good, but if you include protein, I mean, certainly fish and chicken is a little bit better. You know, a lot of my patients go, oh, I heard nuts were good. And I just want to clarify, nuts are okay. But first of all, they're supposed to be raw, you know, not salted and fried and baked and right. And what I would really suggest is that you put things in a small, you know, baggie and count out like 10 or 12 nuts. Because I have, you know, when people drink water in their bathrooms in a Dixie cup, so I often use the Dixie cup example, that you should really not have more than about a quarter of a Dixie cup of nuts. And people look at me like, oh, I thought nuts were, you know, healthy. And it's like, but not in excess, because they're pure fat. Right. And I think a lot of people don't realize, or again, don't stop to think about portion size and the fact that they just ate 800 calories of nuts. And, you know, that's not the plan there.
Dr. Crawford, if somebody's listening to some of the things that you're saying and some of the advice that you're giving, and they say, I don't know how to incorporate those things in my life, or I I've tried that and I haven't done that yet. What would you say to them?
Well, first of all, not everybody can afford something like a trainer or a life coach. But if you can, that's a great thing. Through insurance, especially if you're diabetic or pre-diabetic, there are excellent diabetic teaching classes. And if you've never been referred to that, they work with you for about 8 weeks. And they kind of work with you on diet and how many carbs and how to coordinate food. There's also many, many books out there, and there still are bookstores, although there are fewer and further between. And there's libraries.
It's good to walk to them.
Yes, and there's libraries that you can go in and look at the ABCs of cholesterol, or take out books and kind of say what is a heart healthy menu. The one thing I really have to say is it only works if you're going to use it. So before you buy something, I would definitely take the time to read through different books and just kind of say, these are recipes I would actually use, or this is stuff that I can afford and I will actually do it. It is more expensive, to eat healthy than it is to stop at the drive-thru and get the dollar menu, unfortunately.
And do you think somebody has a spouse or a partner, significant other they're living with, to engage them in the process and do it together?
Oh, yeah.
It's hard to do things alone, isn't it?
It is. And I will say though, if your partner smokes, that doesn't mean you have to. At some point we have to take it upon ourselves to say, I'm going to be the trend setter, not wait for the other person. So really a lot of it is prevention, education, maybe getting your kids involved, because I can't tell you what stopping smoking or eating better or seeing mom or dad or grandma or grandpa suddenly drop 30 or 40 or 50 pounds, what it does for the grandkids too. Because I think so many people say, this is just genetic. And I think there's a difference between genetic and people being used to seeing people order a large pizza and eat it all themselves. That's not genetic. That's just watching somebody socially practice a certain way that they shouldn't. There's a couple other things I just thought of too. If you've had a heart attack and you haven't had some testing since your heart attack, to make sure that I'll use a term, ejection fraction. Mm-hmm. So your EF or ejection fraction, if it is low, you may be a candidate for one of these pacemaker defibrillators. Mm-hmm. And the reason for that is if you have a weak heart, you're at much higher risk of sudden cardiac death. And that is something that, maybe you stopped going to your cardiologist and you went back to your family doctor and you guys talk a lot, but maybe you haven't had any cardiac testing in 5 years. Mm-hmm. I think there's something to be said for doing the right test at the right time too. And just making sure that you've been assessed properly to make sure things haven't changed, especially if you didn't used to have swollen ankles and now you do. Is that because your valve is leaking? Is that because your heart became weaker? Or are you just eating wrong and you're eating too much salt, But I think you really have to be reassessed and have those types of things.
If somebody wanted to make an appointment with you or somebody wanted to see you, how do they do that?
We are at Eastlake Cardiology, and I don't know, the phone number is 586-498-0440. Mm-hmm. We're over in St. Clair Shores on Little Mac and 10 Mile. We also have offices other places in town. Mm-hmm. So absolutely, we'd love to help and set up a plan for patients that are ready and willing to listen. Also, there are many clinics through the hospital that people can be seen and assessed as well.
It's best to be proactive and ahead of the game rather than try to catch up.
That is true, for sure.
Well, Dr. Crawford, you've been most helpful. Thank you for spending time with us and sharing with others about heart disease and your specialty.
Thank you for having me.
And thank you to you as well. As always, we appreciate the time that you spend with us. Take good care of yourselves and those around you, and have a great day.